Hi, it's Dr. Danielle Andry here in Houston, Texas. I work at the Oaks Plastic Surgery, and I'm going to go through cohesivities of implants real quick with you. So the majority of implants that we use are the Allergan Naturel implants. So one's gummy, one's gummier, one's gummiest. But in actual terms, they're responsive, soft touch, and cohesive. And I'm going to show you kind of what that means as far as breast augmentation is concerned. So this one is the responsive. You can kind of see how this sits, more of a teardrop shape, but whenever you put it in a bra, it can kind of go up. But whenever it's just sitting on your chest, you're going to get much more of a teardrop shape. They're also a lot softer whenever you squeeze them. The next step up is a soft touch. So I'm going to hold these up right next to each other, and you can see how this one's going to sit a little bit more in a teardrop shape. It does have a little bit more rippling up here, whereas this one sits a little bit more rounded and has a little bit less rippling. Also, whenever you squeeze them, this one is a lot softer, this one's a little bit firmer. The third step up is the cohesive. So you can see this whenever I hold it up, that's like a very, very round look, versus this one right here, which has just that little bit of rippling, a little bit of teardrop that kind of is still there, versus that one that's completely round. And so you can really tell the difference between the responsive and the cohesive. That one's much more of a teardrop shape, a little bit more rippling. And this one basically has a very round shape with very, very little rippling. There's one other implant that I do like to use, and this is the Sientra implant. I feel like this is a very good kind of in between for some of those. Whenever I hold this one up, there is a little bit more rippling right there, but it also gives you this more projection through. So if you have nice good coverage of your tissues, this is a great implant to use. I feel like it's very similar to the responsive as far as the amount of rippling and kind of the amount of teardrop that's shown. You can see there. But this one is a little bit softer whenever you squeeze it versus the soft touch. So some people who like the soft touch or the cohesive type of look, but they feel like the implant's a little bit too hard, this is the good option for those patients. So we really have an implant that will fit anyone and will really give you exactly what you want.